second session of our Caregiver Conference. We have speakers for today will be Dr. Monica Parker, Ms. Rhonda Hunter, and Ms. Queenie Jordan. We will first start off with Dr. Parker. Dr. Monica Parker is a graduate of Fisk University and the University of Nebraska Medical Center. She joined the Emory School of Medicine faculty in 1995. She has transitioned roles as a gerontologist, a primary care provider, and she transitioned to that of clinical research investigator. She now leads the Minority Engagement Corps, one of 6 cores of the Emory Goizetta Alzheimer's Disease Research Center. She's a recipient of several honors. The most recent was given to her the Yellow Rose Award by the Georgia Legislators' Women Caucus in 2021. Castle McConnell Associates named her one of Atlanta's top doctors in family geriatric medicine from 2009 to 2013, as published in the Atlanta magazine. Dr. Parker.
Good afternoon, ladies, and thank you again to the Blue Walker Senior Center and DeKalb County for again inviting me as a representative of the Goizetta Alzheimer's Disease Research Center to talk to you a little bit about brain health. And so one of the things that I do routinely is called Dementia 101. And part of that is because we frequently have patients, or I should say family members, that suffer from this disorder, but we don't really know enough about it or haven't been aware of what we can do, let's say, to help take care of people with it, to recognize the signs and symptoms. My purpose here today is to let you know that dementia is not a normal part of aging. It's not a normal state of affairs for any of us. And some things that look like dementia are actually something that can be treated. Delirium related to an infection, medication, or some other process. In any event, let's keep going so we learn a little bit more about dementia and learn a little bit more about resources that we have available for us. Who gets Alzheimer's and related dementias? Well, if you look at this little graphic, more than 50% of the people over the age of 85 are likely to have some signs and symptoms or a diagnosis of dementia. It starts between 65 and 75. So early onset Alzheimer's or dementia is that occurs before the age of 65. And there are things that occur before the age of 65 that can cause one to have dementia. And after 65 is what we call late onset dementia. So if you have dementia symptoms and you're not 65, you have an early onset dementia, maybe Alzheimer's, maybe something else. We know that by the year 2050, we're going to have nearly 30 million people in the country who will have Alzheimer's or related dementia. Next. This particular slide is one of the most updated Alzheimer's Association slides that puts in a capsule form what we need to know about dementia. It's the 6th leading cause of death in the United States. For African Americans, it is the 4th leading cause of death. Okay. More than 15 million Americans provide unpaid care for people who have Alzheimer's or other types of dementia. And if you're the spouse, it's probably you. But if you're the adult child and you have parents that are still living, it's probably going to be you. Those caregivers, and I count myself in this number, provide nearly $18 billion of care. And that cost of care, if you were to pay somebody other than yourself to do that care, is about $230 billion a year. 35% of all caregivers for people with Alzheimer's or another dementia have reported that their health is worse. And not only is their health worse, their mental health, their mood is a whole lot worse than other people. There are 1 in 3 seniors dies with Alzheimer's or related dementia. And of all the leading causes of death in the country, this is the one for which we have no definitive cure. Next slide, please. So what is dementia or a neurocognitive disorder? okay? It is symptoms or behaviors that interfere with one's ability to conduct his or her normal occupational, social, or professional life. A lot of people with early onset dementia, and this is why it's important to get to a doctor and to kind of have an evaluation. In my practice, I've had patients who have started to have poor job performance, previously top-notch performers, not doing quite as well. Well, a lot of times this is when we start to notice that people are having difficulties. If somebody who's been a good employee all of a sudden is not, and their work is suffering, there's usually something intervening that might be causing that disruption. And it's important to get that evaluation, to get that diagnosis, because rather than being dismissed from your job for poor performance, maybe your job poor performance is related to a medical condition from which you are not going to recover. In that case, you can retire early, you can get disability benefits, but you cannot get disability benefits easily if you lose your job. So that's important. And it's important to know what's causing these things and to evaluate carefully, because some of the things, as I've alluded to before, may be something that's treatable and something that you can fix. Next. So what are the different things that go into brain health? So when we think of dementia, or we even think of Alzheimer's, a lot of times all we think of is memory loss. And memory loss is important, but there are about 6 other brain functions, we call them domains, that your brain helps you do, that when they are deficient or there are deficits there, will give you a clinical diagnosis of dementia. A clinical diagnosis of dementia doesn't tell you what's causing it. It just means that you have deficiencies in these areas, and by definition, you have dementia. So complex attention, much like what we're doing now, I'm talking, you're listening. Executive function, a previously learned ability like driving or cooking. It says here the ability to plan, organize, and complete tasks and projects. Learning and memory, perceptual motor, making your body do different things, picking up a pen, writing with it, doing things like that. Using the proper word for the proper item. Communicating in a language that's consistent with what your audience is. If you grew up speaking Spanish and then you learned English as an adult, as you develop dementia, you will probably revert back to speaking your first language, which was Spanish. And then social cognition. A lot of family members with dementia don't often recognize their family members. Distant cousins we're not worried about, but we're frequently worried when our husbands don't recognize their wives, don't recognize their children. It's like, oh, mama, yeah, you know who that is. That's your baby boy. Well, she may not recognize her baby boy. So if you have deficits in 2 or more of these functions, we say that you have a diagnosis of dementia. We can't tell you what's causing it, but because you have deficits in 2 or more of these things, we give you a diagnosis of dementia. Next, please. Okay, there are several different types of dementia. As this pie chart shows, the most commonly diagnosed is Alzheimer's, followed by several others. The second most common is mixed, Alzheimer's disease with dementia of Lewy bodies, or Alzheimer's disease and vascular dementia separately, which has to do with hypertension, which has to do with diabetes, which has to do with anything that's related to the development of a stroke. Then frontotemporal dementia and other dementias. And in this category, we have to include things like chronic alcoholism and HIV encephalopathy, or AIDS related dementia. Next. So on the left-hand side of your picture is a picture of somebody who has had a brain autopsy, a normal brain on the left and an abnormal brain on the right. It used to be that we had to have autopsy to tell us whether or not we developed Alzheimer's. But if you look at the bottom of the brain on the right-hand side, you see like there's a big hole over there on the kind of like a semicircle on the bottom. And if you compare it to the left-hand side's all filled in, but there are holes in the right-hand side. That's the hippocampus. The hippocampus is associated with memory and function. And so when you have degeneration of that hippocampus, that generally indicates that you have Alzheimer's. That's a pathologic feature consistent with Alzheimer's. Next, please. So dementia symptoms, I've talked about some of them, memory loss, but other things that are associated with developing dementia are repetition of words, phrases, stories, loss of bowel and bladder function. People think that people are just not able to control things, but you know, bowel and bladder function is a neurologic function, and Alzheimer's and other dementias are a neurodegenerative process. So if you're having trouble with your memory, you may also have trouble with controlling your bowel and your bladder. That's why a lot of people have problems with incontinence.
Okay, ma'am, I'm in the middle of a conference
The inability to independently dress, groom, or toilet yourself, gait instability because the posterior part of your brain is degenerating. And a lot of times what we see most commonly are personality changes. As dementia progresses, somebody may become psychotic. You know, they hear things, they see things, and they make unusual and outlandish claims. Next. Some behaviors that are associated with dementia include wandering, not going to sleep. She doesn't stay asleep at night. She wanders out in and out of the house. Again, personality changes. People are very irritable, distracted. People who have developed compulsive behaviors, maybe it's compulsive cleaning, which isn't a bad thing, or gardening, compulsive buying. I had patients that had collected stamps and entered sweepstakes all the time. And this one, the last bullet, driving difficulties. This is a difficult one because most people who are older don't want to give up driving their car because that's their independence, that's their autonomy. But people who are a little older may have a slower reaction time. They're more likely to get into accidents. They're not visually intact enough to avoid hitting the yellow pole. So you have all kinds of dings on this side or that side of the car. And more commonly, as the case may be, as people progress, they get lost driving in very familiar places. So driving difficulties is one tip-off that somebody may not be having a brain that's functioning as it should be. Next. So how do you address these behaviors? Who do you talk to? Who do you seek out? Well, the first person you need to consult is your medical doctor. You need to make sure that you have a comprehensive medical exam such that these behaviors and abnormal things that we're looking at are things that can be fixed rather than not fixed. And then the other thing that you may want to do if you're starting to see these kinds of changes is to confer not only with your medical doctor, but also with maybe a social worker or case manager, but an elder law attorney to make sure that you have your documents in place such that if you are unable to make decisions, you have in place somebody who can make decisions, but also somebody who can manage your business affairs. All of us should do this, whether we're demented or not. We should have somebody, a plan in place for if we can't make decisions on our own. Next. So we have something in medicine we call the annual wellness visit that Medicare pays for all persons age 65 and above annually. The initial visit includes things that are bulleted below. Looking at immunizations, you get no real physical exam other than your height and weight and a blood pressure. But at this wellness visit, which is a separate encounter code for your doctor and a separate note, is to go over and make sure you've done everything you can to keep yourself healthy. Have you gotten your immunizations? COVID being one of them now. COVID, flu vaccines, hepatitis vaccines. Have you had your vision screening? Have you had a cancer screen for breast cancer, lung cancer, colonoscopy? For men, it's prostate cancer. Have you had a hearing test? All of these are things that are part of the annual wellness visit. It's a checkoff. And if you haven't had these things done at your visit, at your wellness visit, your primary care doctor makes arrangements for you to get those things. Yeah, there are some screening laboratories that go along with it. And in the context of your annual wellness visit, your insurance will pay for it. Outside of the context of your wellness visit, your insurance may not pay for it. But this is also the time we get a baseline assessment of how your brain is working. We will do a depression screen. And depression is screened for simply because it's a forerunner of dementia. And then you do a dementia screen as well. So annual wellness visit beginning at age 65 and doing it annually. And annually you should be getting a dementia or depression screen. which is one of our earlier tip-offs to whether or not somebody's brain is working well. Next. What are some of the things that we can do to keep from developing dementia? I didn't say Alzheimer's, I said dementia. Well, we can treat depression, we can diagnose it and we can treat it. We can avoid alcohol abuse. Chronic alcoholism is a risk factor for a brain disorder. Air pollution early on in life is coming to be a major risk factor, is turning out to be a major risk factor for later onset of dementia. Hearing impairment. Early hearing impairment is important to have evaluated because this is one of the ways we interpret the world around us. Obesity, diabetes, and hypertension because of their risk for strokes. Head trauma as an independent risk factor for dementia. Physical inactivity, sitting around, being a couch potato, not walking, being socially isolated. So maintaining social contacts through our senior center, through our social groups, through our church, and certainly avoiding smoking because again, smoking, hypertension, obesity, diabetes, and hypercholesterolemia are all risk factors for strokes, and strokes are main contributors to dementia development in later life or acutely. Next. What are some things that you can do to protect the brain? Some of what you are already doing. Social engagement, that's a big thing. Education, literacy. And when we say that, it's not everybody needs to go get a doctorate. And in our circles and communities of color, we put great emphasis on getting some kind of advanced degree. But in a lot of communities in general, we mean basic literacy so that you can read labels, interpret information correctly. So a lot of times that means getting at least at high school, graduating from high school. Formal training in the music, the arts, languages, and other things are things that help protect your brain. Exercise, anti-inflammatory drugs such as an aspirin if you have risk factors for vascular disease. If you have high cholesterol, taking a statin that protects you from developing problems with your blood vessels like heart disease and strokes. Red wine, yes. Getting enough sleep, 6 to 8 hours of sleep a night, maintaining a healthy body weight, and eating a heart healthy diet. And I'm not going to say anything more other than a heart healthy diet. You can go to the American Heart Association website and figure out what that is. And if you do that, you'll take care of your blood pressure, you'll take care of your diabetes, and you'll do the best you can for your brain. Next. How do we diagnose dementia? Well, it's a process. There's no single test there is a single test that you can order. The FDA has approved a PET scan for diagnosing Alzheimer's dementia. And that's the only test that is approved for that. But for everything else, all other dementias, it's a process. We have to do a medical exam to make sure that there are treatable things that have been managed. We do a brain image, an MRI. The amyloid PET scan is the FDA study that diagnoses Alzheimer's definitively. A neuropsych test, I call it the IQ test for older adults, that's done by a neuropsychologist, a PhD doctor, not a medical doctor. And in our clinic, we do spinal fluid analysis to look for the protein precursors that are associated with Alzheimer's specifically. Now that lumbar puncture isn't going to help you with a diagnosis of frontotemporal dementia or Lewy body or other types of dementia. It may help you with HIV, but it won't help you with alcoholic encephalopathy. But that is part of the workup. Next. There are medications, and I'm going to go through this really quickly. There are medications to treat the symptoms of dementia. Aricept, Razidine, and Exelon, that's one class of medicine, only one of those medicines, not all three of them. That may be added to something called Namenda or Memantine. And then a lot of people with dementing disorders may also be given antidepressant medications. That's what they are. But the antidepressant medications do things to help people sleep a little bit better, help improve appetite, and help improve mood. People who start to hear things, hallucinate, and other things may need other kinds of medicines. But in general, if you just have generic dementia, things like Seroquel, Risperdal, Geodon, other antipsychotic medicines like Librium aren't things that we put people on for dementia because they have side effects that are more likely to be fatal. So we don't want those. But if you had a diagnosis of mental health in your adult life and you needed these medications, you still need them in dementia. You just need other things as well. Next. So where are we with research? I'm with the Goizetta Alzheimer's Disease Research, and I have a direct appeal to you because we need healthy people. Anybody who was able to sign on to this call needs to be a part of our observational study and healthy aging research. In the United States and around the world, there are over 136 different clinical trials that are ongoing. You can look at the chart, but 80% of the clinical trials are focused on medications to actually treat or modify Alzheimer's disease. But there are other studies that are looking at caregiving, that are looking at control of behavior and diagnostic kinds of things. If you've been on our Brain Talk Live, we have phase 1, 2, and 3 trials. Phase 2 and phase 3 trials are what we call safety and dose escalation trials. We're looking at a medication to see how much medication is required to get the desired change. And once we get to that, if we think that's what it is, we have to have about 3,000 people to test to see whether that medication has actually done what we said it's going to do. So this is the process by which the COVID vaccine was developed. It went from phase 1, which is from animal models to humans, to phase 2, phase 3. And now the vaccines are no longer on emergency use authorization. They have full FDA approval for use. So there's no reason for us to resist getting a COVID vaccine because it's been fully tested. It was tested not only for COVID, but the COVID the COVID vaccine was developed as a result of some of the vaccine research that was going on with Ebola. That's why they were able to come up with a vaccine so quickly. So it has been fully tested and vetted for safety. Next. There are a number of drugs in development, and in the news recently, we have one drug that has been approved by the FDA as an interventional drug for treatment of Alzheimer's, and that's a medication called aducanumab or Aduhelm. I just learned this morning here at Emory, we will not be giving this medication to our patients. It will not be prescribed by doctors in our cognitive neurology clinic because of the requirements for clinical testing using this particular drug. And I think that the powers that be have decided that the cost for administering the medication was much greater than the perceived benefit. So Emory University will not be administering aducanumab other than through a clinical trial. And we do have some trials, clinical trials for aducanumab and other medications. Next. These are disease modifying therapies for Alzheimer's. It's not for alcoholic disease or vascular disease. Again, this drug that's just been approved by the FDA is not going to be administered at Emory University or even in our Georgia Memory Net centers. There are other monoclonal antibodies that are in development, and it's likely that their administration is going to be the same as aducanumab. So we're not likely to be administering those medications anytime soon. Again, each of these medications is available through clinical trials. Next. I want you to appreciate that dementia is not a normal part of aging. You have dementia symptoms that can be caused by other things, which is why it's important for you to see a medical doctor to sort out what some of those things are. There are now monoclonal antibodies in development, one only that has been approved for treating Alzheimer's disease, but not the other dementias that I listed before. We're in ongoing research to better define the disease process for dementia and look for effective treatments that are less expensive. And my final note again, if you haven't gotten your COVID vaccine, and I'm sure that most of the, how many people do we have up here now? 38 people who are in the audience have already gotten their vaccinations, whether it's COVID vaccine, influenza, pneumonia, hepatitis, or a diphtheria, tetanus, and pertussis vaccine. Please make sure that you are up to date on your immunization. Grandparents give their children whooping cough. We can also die from COVID. So if you're a person of color and you're taking a medication for hypertension, cardiovascular disease, or colitis, or anything like that, or rheumatoid arthritis, you are a vulnerable person and you are at risk for developing this disorder. Please get your vaccine so that you don't die. You don't want to die, just don't get it. That's okay. Thank you.
Thank you very much for that presentation. That was great information. Remember, all questions, please put in chat. And also remember to go to chat and answer our survey that's in chat. Next up, we have Rhonda Hunter. Thank you so much, Dr. Parker. That was wonderful. And we hope you hang around for questions for Q&A. They will be at the end of all presenters. So if you have any questions for any of the presenters, please put it in chat. Thank you. Up next will be Rhonda Hunter. Rhonda Hunter is a health insurance specialist with the Center for Medicare, Medicaid Services, the U.S. Department of Health and Human Services. She conducts outreach and education activities to the public and health professionals throughout the 8 southern states. Currently, Rhonda works with the states of Alabama and Georgia. Rhonda is a graduate of Spelman College. She has been employed with Medicare since 1988 as a student while attending college. When she graduated, she worked her way up through the ranks in various customer service positions. Rhonda has been a member of the outreach team since 1997, with changes of the Medicare Balanced Budget Act traveling among the 8 southern states. Rhonda has received numerous awards for outstanding customer service during her career. Rhonda is happily married with 2 daughters, Ava and Amanda. She currently resides in Atlanta, Georgia. Thank Rhonda Hunter.
Thank you so much, Brenda, and I appreciate being able to join, and I'd like to thank you all for having me. And just know that I look forward to these caregiving meetings every year, not only to share information, but it's good for us to hear it as well, to know what resources and information is available. And interestingly, when I was thinking about this event, I was reflecting on the past 2 years with COVID and how much our lives have all changed. And if you think about it, we all are now caregivers, whether it's for friends, for family members, children, older relatives. And I'm sure some of you are even assisting relatives who are long distance, friends and family members, and you may even be helping your neighbors. So my perspective has changed when I think about my relationships with my parents as well as my husband. Interestingly, my husband was a caregiver for his grandmother for some years, and she passed last year. But one of our fondest memories was one day she wanted to get out and enjoy the warm weather and the sunshine. And he said, as he pushed her in the wheelchair, he was telling her, "It's my turn now, Grandma. I remember you pushing me in a stroller as a child." And they had a good laugh about that. And just a couple of years ago, my mother actually moved near me to be closer to the family. And last year she stopped driving. And thankfully it didn't turn into an argument because, she wants to stay safe and keep other people safe. So now, I'm checking on her daily. I go with her to her doctor appointments. And it's interesting, I appreciate Dr. Parker's comment, because one of the worst things a doctor can tell her is, that's a normal part of aging. And she's like, no, I have more questions. I need more information. So she really speaks up and advocates for herself. But one thing that I have to confess is that when I sometimes go to visit, I would go in and start doing. And what I mean by that is I would go in and I would check her mail, or I would go into her dishwasher, or I'd start putting dishes up, or I'd check her washer and dryer. And then I had to catch myself and realize, how can I best help my mother? So now I'm at the point where I had to take a step back, and I actually had to apologize and actually ask her, Mom, I'm really trying to be helpful. I know you want to be independent, so let me help you when you need it. So what I do now is, Mom, I'm going to the grocery store. Can I pick something up for you? Or would you like for me to do this for you? Or would you like for me to do that for you? So when you hear this presentation, I hope you just think about how people can maintain their independence and their dignity, but you can also be helpful. So I'm going to share some Medicare information with you, as well as share some helpful resources with you. One moment. And when people contact us at our office, interestingly, they always say Medicare is the red, white, and blue card, which it is. And Medicare is the national health insurance for anyone over the age of 65 or under 65 with a disability, or anyone with end-stage renal disease. You do actually enroll with Medicare through our sister agency, Social Security. Social Security enrolls people into Medicare and determines eligibility. Once you are on the Medicare rolls, our agency, CMS, Centers for Medicare and Medicaid Services, actually administers the Medicare program. Let's talk about the parts of Medicare. Part A is your hospital insurance. This covers your inpatient hospital stays, skilled nursing, home health, and hospice should you need it. Now keep in mind that while you or your spouse are working, you're actually paying into the system through your FICA taxes. Part B is what we call your medical insurance. It covers your doctor services, outpatient services, home health, durable medical equipment. These are items such as wheelchairs, walkers, canes if you should need them, and preventive services. And Part D refers to the drug coverage. And as you see from this chart, there are two ways you can get your Medicare benefits. The first is what we call your original Medicare or fee-for-service, where you present your red, white, and blue card to any doctor or provider who accepts Medicare. And it's up to you to decide if you want to add Part D for your prescription drug and a supplemental insurance or a secondary insurance to fill in the gaps after Medicare has paid its portion. Keep in mind, Medicare usually pays at 80% and you're responsible for 20%. So many times people may have a secondary insurance to fill in those gaps. They may purchase what's known as a supplemental insurance policy or a Medigap plan, or they may have coverage through a former employer, or they may be eligible for Medicaid, which is a joint state and federal program based on lack of income and resources. Or an individual may have what's known as Medicare Advantage or Part C. And you may hear different terms such as HMO, Health Maintenance Organization, PPO, Preferred Provider Organization, PSO, Provider Sponsored Organization. In short, it's a network of doctors and providers that provide services for its members. So you'll get your Part A hospital, Part B medical, Part D for your drugs, and you get it all through that network of doctors and providers. Now, keep in mind, you'll continue to pay your monthly Part B premium, but there may be additional benefits over and above what original Medicare covers. The most common being dental, vision, hearing. Some even cover gym memberships and transportation. But we encourage you to do your homework before you enroll with a Medicare Advantage plan. Now, one of the most important things, to simplify it, because I just have a very brief period of time with you, is when you are assisting someone as a caregiver, when you think about Medicare, the one thing I want you to think about is the service medical or is it custodial? Now, custodial care is activities of daily living, such as eating, drinking, bathing, toileting. those items are not covered by Medicare. Medicare covers items that are medical necessity. So it's very important to make that distinction. But please know that you can always contact us at 1-800-MEDICARE or the Medicare.gov website to see what services are covered. But please know that that's a very important distinction to make. Also, we do have our website, Medicare.gov, where you can actually go on and see publications. You can see Medicare cost. You can find helpful contacts. And every year in the fall, you get your Medicare and You handbook that's mailed to you directly, or you can receive it electronically. And the last resource that I'm showing is Georgia Cares, which is the State Health Insurance Assistance Program. Please know that if you have family members or friends that you're assisting in other states, each state has a state health insurance assistance program that offers free health insurance counseling for people with Medicare and their caregivers. So you can compare your health plan options for free. No one's going to try to sell you anything, nor do they make recommendations. We're always looking to improve our presentations. So if you'd be willing to take a moment and offer feedback, we do have this link, just a few instructions. If you decide to complete the evaluation, the title for the event would be number 4 in caregiving meeting. Today's date, 4/13/22. And for audience, you would note that you're a Medicare beneficiary. And for those of you who have smartphones, we do have a QR code. And the last resource I'd like to leave you with is my contact information. And as you see here, we're still working virtually. So you're welcome to contact me by either my email address, which is my name, or my phone number, which is listed below. And I will share this PowerPoint after the session, so you'll have this in writing. And lastly, I will also be sharing a helpful contact sheet with you that lists helpful resources as well. So it includes the elder care locator, which you can find when I mentioned about custodial care or different services in the community. That's available, as well as the National Council on Aging's benefits checkup. And I'm mentioning those as well because they're both national resources that can assist you with finding additional benefits if you are assisting someone as a caregiver. Thank you so much.
Thank you, Rhonda. Great presentation. Now we'll move on to our next presenter. And our next presenter will be Queenie Jordan. Queenie was born and raised in New York by her grandparents. The love and admiration Queenie had for them inspired her to pursue a career working on and with and on behalf of seniors. Those that know her very well are aware of her passion for older adults. This year, Queenie is celebrating her 26th year as a gerontologist, which is specialist in the field of aging. She received her degree from New York College in the state of New York. Queenie was the manager for 22 years of the Grady Health System Service Program. She served on the committee to build the Grady Emma Darnell Geriatric Medical Center and the Grady Acute Care Elderly Inpatient Unit. She is involved with many research projects that are related to improving the quality of care for older adults. Advocating for seniors is a part of her DNA. After working in gerontology for over 36 years, Queenie has decided to step out on her own. She has formed her own company, Aging Forward, LLC, which focuses on helping our senior population. Queenie Jordan.
Thank you, Brenda. Good afternoon, everyone. I hope everyone is doing well today, and Happy New Year to most individuals. It's my pleasure to be talking to you today about a topic that is very near to my heart. Many of you, I didn't hear, I'm sorry, I'm having challenges with my computer, so I didn't hear much of what you said, but I hope that you heard that I had been working at Grady for 22 years, and I just went solo on my own February of 2022. But one thing I want to share with you is that during this time, I worked on multiple projects that had to do with older adults being rehospitalized. And I myself, who was an older adult, became hospitalized at Grady twice. And this presentation and the tips that I'm about to talk to you about, which is hospitalized, what to do, and tips on reducing a return, is something that I lived by when I was hospitalized at Grady. As all of you may be aware of, hospitals are germ-ridden facility. I mean, you're there for us to stabilize you, help you to feel better. But while you're there, you're going to encounter some germs. The older you get, your body is more susceptible to illnesses. So we want to be able to stay out of the hospital as much as we can. So I am going to present to you some tips, and I am willing, Brenda has a copy of this, and so I ask that she please share it with you all. So this is a checklist for things to do in the hospital, and these are the instructions. I want you to be able to use this checklist often during your stay in the hospital. Talk to your doctor and staff, like a discharge plan, a social worker, or a nurse, about items on this checklist. Put a check next to each item when you, your caregiver, or loved ones complete it. Be involved in the decisions about your hospitalization. Also be involved in the decisions about what will happen after you leave. Now, the thing is that a lot of times we want to believe that the doctor knows best, and I'm gonna listen to everything they say. It's important and it's imperative that you ask questions, and that you feel that you have the right to ask questions about what is going on, what the tests mean, and also you have a right to refuse. Also, if there's a test that you believe that may provide more clarification, you can also suggest that. So just be active in the decision as it relates to your health while you're in the hospital. Be sure your doctor and nurse answer all your questions before you leave. This was an issue that I found. Many times people, once they leave, they believe that when I leave, I'm going to call back. I'm going to be able to speak to that wonderful nurse, that wonderful doctor that cared for me while I was there. Well, you might not be able to get in touch with them. So you want to be able to write down all your questions while you are hospitalized and get that addressed before you leave. While in the hospital and before leaving. While hospitalized, ask questions about the illnesses that landed you in the hospital. So you want to know more about what your diagnosis is and how the symptoms and what came with the diagnosis, why that occurred. Okay, so if in fact, and those kind of questions to me help you to understand how the disease manifests itself. So let's just say, but unfortunately, if you had a stroke, you had the symptoms of a headache and dizziness, you had pain in your jaw. So a lot of people don't realize that sometimes pain in the jaw can, be a symptom of a stroke or whatever the case may be. These are the things that you want to ask questions about, like, I've had this symptom before. Should I now be aware if I have this, that something is going on wrong? So you want to ask as many questions about the illness and the symptoms that you were experiencing prior to getting sick or while you were getting sick. Ask about the test your doctors order. When the results are the back, ask questions about what the test show. Very important for you to ask questions and get an answer or answers in a way that you understand. Patient-friendly information and the doctor speaking to you on a level that you understand is very important. Make sure doctors and nurses know about all the medications you're taking before your hospitalization, prescription, over-the-counter meds, vitamins, and herbal supplements. And whether if you drink or you smoke marijuana, you also need to be honest with your doctors about that. Ask if you should still take these after you leave. So what I have found in my 22 years in healthcare is that many times people, when they are discharged from the hospital and they're given additional drugs, they're not asking questions about the medications they were taking prior and whether or not they should continue. And so I want to give you an example of a patient that she was cognizant enough to be aware of the fact that the doctor had said that she should discontinue taking a particular med. So she had gotten her granddaughter to pick up some refills that were called in prior to her being hospitalized. And so when the granddaughter went in and picked up the refills along with the medications that were prescribed for her, she noticed that the prescription that the doctors had told her she should stop taking was a part of the medication that her granddaughter picked up. Now, if she had taken that medication, something may have happened to her in a negative way. So you want to know about all the medications you should be taking after you leave. And therefore, it's very important to be aware of the medications that you were taking prior to your hospitalization. I also say it's very important that you walk around with information on your person wherever you go that talks about the medications that you're currently taking. Because if something happens to you and you're not able to verbally give that information can be found on you. Before leaving, ask where you'll get care after you leave, after discharge. So when they say discharge, that means after you leave the hospital. Do you have options, for example, home health care, physical therapy at home versus a facility? Some people, once they are diagnosed with something, they need rehab, but you can always ask if getting rehab therapy at home is better or an option for you rather than to go to a setting outside of your home. Know who to reach out to if there's a problem. Be sure to get the name and contact information of who you should contact. And what I'm talking about there is hospital staff. You want to know if you do have any questions, is there someone there that you can follow up with? Also, be aware that many facilities are offering you access to electronic medical records. That's key. That's key because you can always utilize that information for your person and of course share that with your doctors outside of the hospital, or make sure you keep the written information that they give to you prior to discharge. Make sure you know all the medications you should be taking after you leave. And I know I mentioned this before, but it is critical. The ones prescribed while in the hospitals and the ones that you take home. Know when you should take them and the possible side effects. If problems arise, know who to contact. Write down, I'm sorry, there's a typo there, the person's name and contact information. That is key. You want to know if you are taking multiple medications, you want to know all the medications you should be taking, and you want to know when it's best to take them because you don't want to have an interaction, allergic reaction between medications. That can land you back in the hospital. While in the hospital and before leaving, continue. Has your illness caused you to make changes in diet or activity? Understand the do's and don'ts before leaving. Many people say, I've been exercise, I walk 3 times a week. You need to ask whatever your normal habits are, whatever your diet is, you need to know whether those things have to change or long term. You need to know the do's and don'ts, because not knowing that can also land you back in the hospital. Make sure staff or you make follow-up appointments with your personal doctor or specialist. Key, very key. If you're hospitalized and you are able to contact your, especially a primary care doctor, or maybe it's your specialist because maybe you're in the hospital due to a specialty type of disease. Like if you're diabetic, you may be seeing an endocrinologist. You will want to or should make sure that your physicians are aware of the fact that you have been in the hospital. If you're not able to do it while you're in the hospital, make sure that you're able to do it as soon as you get home. And if you need a follow-up appointment and you need some help, you can ask to see if staff can help you with that, or if you have someone in your personal life that can do that for you. If you need transportation to get medication or to get the medical appointments, talk to a social worker or case manager before leaving. We have had multiple of patients in my history that because they lack transportation to get medications prescribed for them or to be able to go to doctor appointments, they became sick enough to re-enter the hospital, something that you do not want to do, because then your body is even more of a frail state. Excuse me. Be sure your family or close also know what you will need to care for yourself at home. I tell people a lot of times, if you have not been hospitalized, a lot of things go on at one time, and a lot of information is given to you, and you can get really bombarded with information, plus the stress of being there, period. On the day that you are to be discharged, you may not know until that day. So you may not have ample amount of time to prepare someone to come down and be a part of the visit to discuss the discharge process. And with COVID, I mean, a lot of the health systems are relaxed on, now you can have visitors. But during COVID, we were not allowing people to come in for the most part. So I say this, you can always provide your phone if you have a phone, or the hospital has a phone, put that phone on speaker so that that person on the other end can hear what the discharge instructions are and be able to ask questions and be able to talk with you about it, just in case you didn't understand or you forget. You can do that. And many people now are used to FaceTime or Duo. You can also do that. It is welcome in the hospital setting. If you need medical equipment for home, walker, wheelchair, raised toilet seats, etc., or supportive services in your home, like Meals on Wheels, bathing assistance, etc., ask to speak with a social worker or case manager before leaving. Be real about what you need prior to leaving the hospital. People don't realize that a lot of times when they leave and they need medical equipment or they need services in their home, particularly services in their home, if that service is not ordered while you are still in the hospital, then your Medicare may not pay for it, or your insurance may not pay for services. So please know that you need to speak up when you need assisted devices or services in your home. Speak with a social worker, discharge planner, or case manager before you leave, so that a lot of times the equipment will be there when you or the same day or next day after you are returned to home. Ask if you are ready to do some of the below activities and circle the ones you need help with and inform staff. So if you need bathing assistance, dressing, using the bathroom, climbing stairs, cooking, groceries, shopping, house cleaning, paying bills, getting to the doctor, picking up prescription medication. I broke it out for you so that it kind of takes the thinking out of it. What I want you to do is focus on where you are now as far as your health is concerned, and be real once again about what it is that you can't do that you may need help with, so you can communicate that. And last page, make sure you have support like a caregiver in place that can help you if you need it. If the caregiver will be helping you after discharge, provide that name and contact information to staff. very important. If they need to follow up with you about anything, you're not available, they may need to contact that caregiver. For example, sometimes people are discharged from the hospital before all your labs come back or your results of your tests come back, and the hospital may need to follow up with you. Well, if you have a caregiver that's helping you, emergency contact person, please remember to leave that information with staff at the hospital. Ask staff to show you and or your caregiver about other tasks that require special skills, like changing bandage or giving a shot, and illustrate to the staff the task can be that task can be performed successfully. Ask for the name and contact information for someone to contact if necessary once you're discharged. What I mean by that is, let's just say you had surgery, you have a wound that needs to be dressed. And so, yeah, they may have a nurse that can come out, but maybe not as often as that wound changing, dressing need to happen. So you may have someone on staff at the hospital to train you, and also someone else, if possible, on how to but to change the dressing. And you want to be able to show that staff before leaving and ask questions about what you've learned and what you believe should be done. Ask to speak with a social worker or case manager if you're concerned about how you and your family are coping with your illness. Write down the information shared in support groups and other resources. Maybe you were just diagnosed, off a bed for, of having cancer. You know that your daughter, your family is going to have a rough time. Maybe there's a support group that can help all of you, particularly the staff, in dealing with it. Make sure you get that information, and they may be able to give it to you, print it off, give it to you, or you can write that information down. Talk to a social worker or your health insurance plan if you have questions about what your insurance will cover and how much you'll have to pay. Ask about ways to get help with costs. Sitting there worrying about bills can cause your pressure to go up, and I can't pay for this, I can't pay for that. You need to ask as many questions as possible. There may be even grants or services that can help you with some costs if you don't have insurance or you don't have adequate insurance. And I left you a little space, and of course, that you can print this off and bring it with you. You can use this and write down your questions and your answers to the questions when your doctor or nurse provides that to you. So I have finished with my piece, and I welcome any questions. Thank you all.
Okay, Queenie, thank you very much. It's really a lot of good information. If you would send that worksheet to me so I can send it out to the people on the call, I'd appreciate it.
I forwarded it to you this morning. Is this Brenda?
No, this is Sharon.
Oh, Sharon? Okay.
Yes, ma'am.
Yes, I forwarded to Brenda. Okay.
Okay.
Right.
Now, there are two things. Number one, you see in the chat where we're asking you to complete a survey so we can get some feedback on how our caregiver conferences are working. Then the other thing is, are there any questions? Questions for Dr. Parker, Queenie? And they gave you a lot of information, I know, but if there are questions, do I see
also Rhonda Hunter?
And I'm so sorry, Rhonda. I am so sorry. No questions?
Yes, question.
Okay, go.
Okay, I'm sorry I got on late. Would that be another time?
No, ma'am. This was today. I don't know if no.
Okay.
Well, we can ask our presenters today if they would be kind enough to share, which Queenie just said that she would, and I think Rhonda did too. Is there a possibility that their presentations can be shared with either you, Sharon, or
I would
Brenda?
prefer that they be sent to me because I'm the one that has to send it out.
Yes,
So
so
if they would just
so
send it, they
can
would
you
send
put
it to
your,
me.
Mhm. Can you put
But
your email
but I
address
have-
into the chat for them?
Yeah, but I have another question for you, Cynthia. Is this on the Lou Walker YouTube?
We are recording the session, however, it will not be available at this time.
Okay,
We would have to let them know. So
okay,
what we're asking is that you provide your email address, and those that would like to have the presentation, if available, can be sent directly to you, the request.
okay.
Will that work?
I mean, whatever,
Okay.
if they, if that's the only way we can get the information.
Yeah, right now, I think it is.
Mhm. Okay. All righty.
Thank
No
you, Sharon. Mhm.
questions?
Hey Sharon, this is Donna Dees. I have a question for Dr. Parker.
Okay, Doc, go ahead.
Okay. The question is, in regards to dementia or Alzheimer's or cognitive skills, and at any point or another, does over medication ever come into play?
Hold on one second, I'm sorry.
For changing behavior and
Well,
and maybe
yes.
being looked at as dementia?
Well, that's why I said in the evaluation for dementia, it's a process. And one of the first parts of that process is to meet with your primary care doctor and to review things such as a medication review to make sure that you're taking all the right medicines for all the right reasons and the way they're supposed to be taken. A lot of older adults are taking multiple medicines from different providers, and they're not coordinating. One of the things that happens commonly, really, particularly for our patients that live in rural areas and they come to visit their adult children who have access to an Emory, and I want mama to go to this doctor over here. I had patients who used to come see me from Sparta, but unbeknownst to their adult children, they would be seeing their doctor down in Sparta and taking that doctor's medicines and then coming to see me and not telling me about the medicines that they were given in Sparta and vice versa. So it's not really clear what they were taking. So a very important part of the dementia evaluation process is a review of medications to see that people are taking medications correctly, that they're taking what they need to take. And when you see multiple doctors for the same thing, you have a tendency to take multiples of the medicines that have been prescribed. Somebody may be on a beta blocker for their blood pressure, but for the doctor in Sparta, they'll put me on propranolol, but then I go to see Dr. Parker and she puts me on another beta blocker, but the patient may be taking both of them. So, but they don't tell you those things. So the answer to the question simply is yes, that's part of the process. And that is why you meet with the primary care doctor first to review those sorts of things. You probably didn't see it on the slide, but a very important part of the dementia evaluation is a review of your medications. Again, a lot of behavior and cognitive changes are attributed to medications and or illness. That's why it's important to start with the primary care doctor first to make sure that that is indeed what is happening or not happening.
Okay, I see a hand raised for Moore. Did you have a
Yes.
question?
Yes, I do. Can you hear me?
Yes, go on. You can, Ms. Moore, you can go ahead and ask your question. You're muted. Can you unmute? Okay.
I'm a caregiver for my brother who does not have Medicare, and he is 77 years old, and I need to find resources for home health services.
If somebody's 77, why doesn't he have Medicare? And I'm going to defer to Rhonda Hunter for that. But as a primary care provider, there are other resources. Medicare is but one. Anybody 65 years of age and older who has worked in the United States of America should be eligible for Medicare. If they meet federal guidelines for poverty, they might be dual eligible and can also receive Medicaid for covering their medical expenses and things like these in-home care. So, and the last thing that I will say for resources, if your brother, age 77, served any time in the military, he is eligible for some military benefits that would allow him to have medical care through the VA medical system. And through the VA, he can also get in-home care as well. So you say does not have Medicare. You didn't say Medicaid.
He did. He didn't pay into the system. He did not have that taken out of his checks. In fact, he needed 4 more credits or something to be able to, but he got older where he couldn't work to get those extra credits. So now I've been taking care of him now for 16 years. So I have checked the vet. He's not a veteran. And through those, I've had home health services where he has to pay privately because he does not qualify for Medicaid either.
Okay.
Because of
Rhonda,
his pension income.
okay, Rhonda, are you still here? Okay, I guess we lost.
I can answer that question though. I
Okay,
can answer
Queenie.
that question. This is Queenie Jordan. So this is something that I've worked on for years. So I'm confident in that I can help you, Ms. Moore, okay? Ms. Moore, you need to contact with your brother, Social Security, okay? And you can actually call the local Social Security office, or you can call the general number, which is 1-800-772-1213. And you can ask about applying for SSI, which is Supplemental Security Income. Many people that have not satisfied enough quarters to pay into the system to get an income, or Medicare can qualify for SSI, okay? And along with SSI, if he qualifies, Medicaid, full Medicaid will come, all right? In the meantime, for in-home supportive services, you can contact the Empower line, and that's the Aging and Resource Disability line for in-home supportive services, and that number is 404-463-3333. There may be a waiting list with that, but you want to start the ball rolling for both, okay? Now, as far as and he could qualify for SSI potentially because of his, his age and all this kind of stuff. It might not be at the full level because they take into consideration the income of other people in the household. Right. But if once he gets Medicaid through SSI, and I want you to hear me loud and clear with this, he then will qualify for something called the SOURCE program. And that SOURCE program will provide in-home supportive services. He's got to be able to keep up with his doctor's appointments in order for him to get those in-home supportive services, okay? Okay. All right. Now, if you have any questions anymore, I can give you my number and you can contact me. Thank you. My number is 404-493-3213. 3213. Yes, ma'am. Thank you, Queenie. And by the way, what county does he reside in? DeKalb County. DeKalb County. Okay. Yeah. All right. Yes, thank you so much. And there's a DeKalb County Senior Services too. Sharon may have that number for you to call in reference to in-home supportive services, Meals on Wheels. DeKalb County Senior Services also has some services that you can talk with them about. Yeah, I'll give you a call, Queenie, because I have some more questions. I would be glad to share my knowledge with you, Ms. Moore. And thank you for being a support system for your brother. Okay? Thank you. You're welcome.
Okay. I don't see any other questions in the chat. Does anyone else have any questions?
Yes, I do.
Okay.
I had to run to get a pen and paper. I needed her phone number. I have something in that line related to this question she had. So
Queenie, can you put your number in the chat, please?
certainly will. I'm putting it in there. And Sharon, I'm gonna also need your email address so I can.
It's in the chat.
It is?
I put it in. Yeah.
Okay.
Mhm.
Okay, I got somebody else. Oh, that's it now. Hold on. Get a pen. All right, I missed it. Could you give it?
Excuse
404.
me? 404-493-3213.
Sharon, for some reason, I guess
404.
there's something wrong with my chat. I can't find your email address is not in my
Okay.
chat list.
Okay, I'll put it in again. Okay.
Thank you
It's
so
right up
much.
under
Thank
the
you.
survey link. It's right up under the survey link.
Oh, okay.
404.
Thank you. Thank you so
You're
much.
welcome.
Okay. Dr. Parker, do you see the one in the chat? That once you're diagnosed with Alzheimer's, are there other medications that can decrease the symptoms?
At this point in time, there are medications, as I indicated in my presentation, that reduce the symptoms. Antidepressants may be used to help with sleep, appetite, mood. Wandering is one of those things where people don't go to sleep. So yes, there are medications that can be used to help with some of those behaviors, but there are very few interventional drugs available that are actually something that reverse the disease process.
Okay. Any other questions? Okay, well, thank you so much, especially to our presenters. We got some really good information, some good telephone numbers. And when I get the information from our presenters, I will share that with you. I want to thank everyone for joining in, and please complete the survey so we know what we need to do going forward. And again, thank you very much for participating.
Thank you for
Cynthia?
inviting me.
Oh, okay. Cynthia, do you have anything that you want to say?
I don't, other than the presenters that today were exceptionally great. You provided great detailed information and you did answer the questions. And we just enjoy having you. And thank you so much for providing this information for our seniors. It's a vital part of us, especially being part of our Lou Walker Senior Center family. So thank you again. And I'd also like to thank all of the people, the participants that came in to partake in this wonderful Caregivers Conference. Just be reminded that we will also have week number 3 of our Caregiver Conference next Wednesday, same time, same place. So we look forward to seeing you. You can find information out on our website, and you can also find it. You probably will get it in an email. But thank you again to everyone. And Sharon, thanks to you, and Brenda also as the overseers of this conference.